Imagine waking up in the middle of the night with a sudden, urgent need to rush to the bathroom. Your bladder feels heavy, the burning is sharp, and the relief you hope for never really comes. Or maybe your child seems unusually irritable, not feeding well, or running a sudden fever, and you can't quite put your finger on why. Sometimes the smallest infection can create the biggest discomfort, and urinary tract infections, or UTIs, are a perfect example. Today, we'll gently walk through what UTIs really are, how they feel, when to worry, and what you can do, starting right now, to heal and prevent them. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. UTIs usually begin quietly, just bacteria slipping into the urinary tract, often from the skin or stool. Because the urethra in women is shorter, the bacteria have a quick path to the bladder, which is why UTIs are more common in women, but anyone can get them. Babies, older people, men, people with catheters, those with diabetes, pregnant women. The list is long, and the symptoms can vary with age. Now let's explore what a UTI actually feels like. Many people notice a burning or stinging sensation when they pee, a feeling so distinct that it often becomes the first red flag. You may find yourself running to the bathroom more often, even during the night, or feeling an urgent need to pee, only to pass very little each time. Your urine may turn cloudy or strong-smelling, and sometimes you might see blood, a pink, red, or even dark brown color. Pain just under the ribs or low down in the tummy adds to the picture. And when the body is fighting harder, fever, chills, fatigue, or weakness can follow. Children, however, rarely describe the classic signs. A baby may simply be irritable, refusing to feed, or running a high temperature. Older children might wet the bed, vomit, or just seem generally unwell. And it's easy to miss that the problem is coming from the urinary tract. Older adults, especially those with dementia or memory problems, often show very different symptoms. Sudden confusion, agitation, shaking, or a noticeable change in toileting patterns may be the only clues. In people with catheters, even subtle shifts in behavior or new shivering can signal infection. So, when should you seek help? If you're a woman between 16 and 64, not pregnant or breastfeeding, a pharmacist can often treat a simple UTI quickly and safely. But if you're older than 65, younger than 16, pregnant, diabetic, male, trans, or non-binary assigned male at birth, using a catheter, or your symptoms worsen, you must contact a GP or NHS 111 urgently. A very high fever, very low temperature, severe back pain, or blood in the urine also requires prompt medical attention. These can be signs of a kidney infection, which can become serious if untreated. And if someone becomes confused, unusually drowsy, or has difficulty speaking, that's an emergency. Call 999 immediately. If a UTI is suspected, a pharmacist or GP may suggest a urine test, but it's not always necessary. Many mild UTIs can improve with self-care, but sometimes a short course of antibiotics is needed, especially if symptoms are strong or not improving. Your doctor might even ask you to wait 48 hours before starting antibiotics to see if the infection settles on its own. But once antibiotics are prescribed, it's important to finish the full course, even if you start feeling better. For people who keep getting UTIs, 2 within 6 months or 3 within a year, doctors may look deeper. You might be offered a different antibiotic, a low-dose daily antibiotic, vaginal estrogen if you're in or past menopause, or even referral to a specialist. Some UTIs become chronic, lingering for weeks or months because bacteria hide deep within the bladder lining. They may not show up on a standard urine test, but still cause pain, irritation, and repeated flare-ups. If your symptoms never truly go away, it's essential to ask for specialist help. You deserve relief and a proper diagnosis. Now let's look at what you can do at home. Paracetamol can help reduce fever and pain. Children can take it in liquid form. Resting and drinking enough fluids so your urine stays pale can ease discomfort. Some people try cranberry products or cystitis sachets. While they may help prevent infections in some cases, they don't treat a UTI once it's already started. Understanding what causes UTIs helps us prevent them. Bacteria from stool entering the urinary tract is the most common cause. Sex, pregnancy, constipation, kidney stones, diabetes, dehydration, and catheters all increase the risk. But small habits can make a big difference. Wiping from front to back, keeping the genital area clean and dry, and drinking plenty of water protects the urinary tract. Avoid holding in your urine, empty your bladder fully and without rushing. Peeing soon after sex helps wash bacteria out. Cotton underwear, changing soiled pads promptly, and avoiding scented soaps around the genitals also reduce irritation. Too much alcohol or sugary foods can irritate the bladder or encourage bacterial growth. And if you use condoms, a diaphragm, or caps with spermicidal lubricants, consider switching to non-spermicidal options. For people who get repeated UTIs, D-Minos or cranberry tablets may offer some preventive benefit. But these products often contain a lot of sugar, and they're not suitable for everyone. If you're pregnant or taking warfarin, always talk to your doctor first. At its heart, a UTI is uncomfortable, disruptive, and sometimes frightening, but it's also very treatable. Understanding the signs, knowing when to seek help, and taking simple daily steps can protect your urinary health for life. Your body is always speaking to you. Learning to listen is the first step toward healing. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.